health care is a very personal thing. It is a matter that touches every American. We've got a Medicare program that really does a good job for our seniors, but it is moving in a way that's unsound financially. Now everybody pays a Medicare tax. That money is used to take care of people who need it, and senior citizens. But the amount of money coming in on that tax is projected to be at a level by 2017, which is not too far away, that money will be in deficit. In other words, we'll have less money coming in than we're paying out, and those are pretty good numbers, I think. So about 2017, we'll be paying out more for Medicare than we're taking in. Also, some of the proposals would increase burdens to the states under Medicaid for poor people. That burden will increase on the states, and they're going to put them in deficits. It'll be the biggest, I think Alabama's biggest expenditure. The governor of Tennessee, a Democrat, has just said this cannot be done in this fashion. We don't have the money. It'll break our budgets. So I guess I'm saying to you that this country is a great, great nation, but we've got a great health care system. It's blessed us for so many years, and I think most Americans want to be sure that we don't mess it up.
That we have the best health care in the world. We are more innovative than any other country, coming up with more diagnostic tools and more treatments than any other country in the world. And the problem is not the quality of the health care. The problem is the cost of that health care. And with that cost in mind, it seems that the real underlying problem then is us having enough disposable incomes after taxes so that we can pay for the health care that we want. With that in mind, what do you think the United States government should be doing or not doing to free up the free enterprise systems so that we can generate the wealth that we need for our health care?
For those in other room that didn't hear it, the question deals with how can we generate, I guess, economic growth that allow people to have some money so they can pay for insurance. If you don't have a job and don't have growth, you don't have it. I think essentially a healthy, dynamic economy needs lower marginal tax rates. One thing. If the government, through its taxation power, sucks more and more out of the private sector, it depresses it. It's just simple to me. And so we need to deal with that. But high cost of health care is a problem. It's doubled in the last 10 years. The average premium on insurance and cost of care is up that much. So that's a very serious problem. And one of the things we could do to deal with that, I mean, a lot of things we could do to help contain that cost. Maybe stop and
yes, Senator Sessions, I have not been asked to come here by an insurance company, a political party. I'm not a racist. I'm not a Nazi, a teabagger, a redneck, astroturf, or part of any mob. I'm angry that thousands of men and women have died for centuries in the defense of our Constitution and our country, and it's being dismantled in less than a year. I would like to know where in the Constitution does it say that health care is a right?
That's right.
Where does it say that legal residents of the USA are responsible for the health care of illegal aliens? And I'd like to know, where does it say in the Constitution that the government has the authority to promote life and death choices with its citizens?
Right.
critical questions, and our government, since its founding, was always considered to be a government of limited, enumerated powers.
That's right.
Well, some things we can do and make life better, but there are costs with all of those. The more the government takes over in area after area of our nation, it's unhealthy in my view.
There's obviously many different factors with health reform, whether it be access for indigent, access for people who are denied insurance, spiraling cost of medical care that may not actually provide much more benefit to a patient's life, but is being paid for by insurances and rising up our costs. Now, why is it that the government is able to legislate many industries very effectively and create change in an industry to accomplish specific goals that are needed? And if they can do that, can that be done in the healthcare reform instead of creating an entire government insurance company that would, from the ground up, try to recreate what we already have instead of modifying?
Good question, Doctor, and I tend to agree with you that, but I'm not sure we've ruled any industry any better in this one. Not very well. And I think that healthcare, we got several law involved in healthcare in a number of ways. First, Medicare, that's a federal-dominated program. Then you got Medicaid, which is a federal, state-dominated program, and then you got state insurance regulation of insurance and federal regulation of insurance. You can't buy insurance across state lines. There are a lot of regulations that are counterproductive, I think. Then you got the lawsuits on top of that Congress does have the power and always has been understood to be able to regulate the nature of lawsuits. So we're already in it. We need to be smart about it and not, when the dust settles, have found that the federal government is deeper involved in it than it was in an unwise way. And it's not easy.